Hi, my name is Judie Vankooiman, and you're watching Life Issues. February's show is about advocating for your health, and my guest is Lynn Croft. Welcome, Lynn.
Thank you. Glad to be here.
You're very welcome. I'm glad to have you. Lynn, we'll start with, what is your title?
Professional healthcare advocate.
Okay, say that 10 times. But it's a very important title.
Right.
And can you please tell us a little about your background?
So I was working actually on the corporate side in pharmaceutical and biotech, working with patients and doctors. And I decided that I saw so many issues going on with their trying to navigate the healthcare system. I started my own company, advocating for the number, your health.
Right, yeah. You're going to put that 4 in there, make sure.
Yeah.
Yeah, that's very good. And how long have you been doing this?
So I started my own business, Advocating for Your Health, in 2017, but I've been doing advocacy on the corporate side since about 2006.
Okay, so good experience. And the name of your organization is Advocating for Your Health. How did you come up with that name?
Well, first of all, I wanted something that's searchable, and that had health advocacy in it. But I thought it also needed to share what I do for you, so I advocate for your health. So I think it kind of explains a little bit, even though professional healthcare advocacy is a little bit new and unusual to people.
Mm-hmm. Very good. And why did you want to start this organization?
Well, as I said, on the corporate side, as an advocate, I was actually working in the rare disease space and watching patients struggle so hard for so many years and through so many doctors just to get a diagnosis, let alone getting treated. I realized that I could bring my own experience to, one, shorten that time, right? And a skill set that would help them get treatment sooner. So, example, getting people into clinical trials or making connections with specialists. And I thought, beyond rare diseases, individuals, when they're trying to face our healthcare system, which is really complicated, and trying to understand what to do next, sometimes it's just the logistics and the barriers that they face. And I thought, I can help them break that down and take over the logistics, take the burden off the patient/client.
Mm-hmm. Especially with the patient being elderly too, right?
Absolutely.
Because they might not understand, they might, be in total shock or, something. So it's nice to, have somebody that can
I
help
often
them.
get calls from the adult children of senior people because they may live out of state or they're just confused. A couple years ago, my mother fell, just to give you an example why I thought, wow, this is a good thing I'm doing this. My mother fell, she went to the hospital, they did an MRI to make sure she hadn't broken her hip. She didn't break her hip, but she was full of colon cancer. She had no idea.
Oh.
So they called me, you have to come home right away. She was in Ohio, went home. And they're like, well, this is like 8 o'clock in the morning after I fly in. My mom's like, I just want to go home. We'll go home to hospice because there's nothing they could do for her. And just knowing that when I called the hospital, you speak to a case manager or the discharge nurse, and they're like, oh, we can't get her out until midnight. I'm like, oh, I don't think so. So I made some phone calls because I knew who to call and got the ambulance transport to get her out and get her into hospice by noon. So, but I was thinking, if I didn't know that, how would you know what to do?
Exactly.
Right, you could Google home health or Google hospice and 100 results come up. So being able to help people really take over that burden and facilitate making the process move faster.
Yeah, and not be so overwhelmed with it all.
Exactly.
Yeah, that's good. And what is professional healthcare advocacy?
It's a fairly young industry and really not very well known. Around 2007-ish, it was decided as our healthcare was changing and becoming really much more complicated that patients didn't have someone who was actually advocating for them. When you go to the hospital and there's a patient advocate, they work for the hospital. The insurance company may have case managers or advocates, but they work for the insurance company. Nobody actually works for the direct patient/client. And so advocacy took off from there. But I do remind people that professional healthcare advocates don't take insurance because they don't work for those organizations, so it is a self-pay. There are about 500 advocates in the whole U.S.
Wow.
Yeah.
And what type of services do healthcare advocates offer?
It's really varied. There are advocates who are lawyers who handle like medical legal issues like healthcare proxies. There are advocates that are physicians that do more like case review and complicated medical issues. And then there are social workers, case managers, prior advocates that can do anything from, let's say, you need to find a specialist, you need a diagnosis, you have a diagnosis and you need to explore options. People who, let's say, break their ankle, can't go home directly first, maybe they need to go to a rehabilitation hospital for a while, get some physical therapy. And then there are individuals who just have come to a point in life, they're like, well, I've been living alone all these years, but I'm ready to move into senior living. But where do you go? There are so many options, it's very difficult. So sometimes people just need to transition, or they have living needs. Maybe they just need a home health person, maybe they just need an aide, maybe they need a nurse to come in once a day for their medications, maybe they just need someone to cook for them. Whole variety of issues that professional healthcare advocates can address. So it's really varied.
Great. And what are factors that contribute to your physical visit, to the physician's visit?
Yeah, so I think there are two, basically money and time. The first about the money, doctors, particularly when we were younger, they sat down with you for 45 minutes because they were paid by their time. Now physicians are paid by the number of patients they see in a day. So you only have about 10 to 16 minutes with your doctor. Got to be organized and ready to go. Plus, it only takes about 23 seconds before they interrupt you. So you want to maximize that time with your doctor. So it's really about how they're paid and the amount of time are the major factors.
Okay. And what are the 4 keys to better communication with your doctor?
You can use these same keys with any communication with another person, but these are the 4 I think really direct mainly to your doctor. First of all, you need to be prepared. Do you have a new symptom you're experiencing, a medical issue? Do you have a question about your medication? The next is you have to learn how to listen. If you're thinking your next question or what you're going to say next, you're actually not hearing the person. So that is a skill you have to calm down, center yourself, and listen. If you prepared ahead of time with your questions, you don't need to be thinking about them. You already know what they are. So that's important. You also need to make requests and not demands. So for example, doctor, my neighbor has the same medical issue I do and she's on drug B. I want to take drug B. That's a demand. Your doctor will be much more receptive if you say, doctor, my neighbor's got the same medical issue and she's on drug B. What do you think about me trying it? So if it ends in a question mark, it's a request, right? So these are all really important when you're working with your doctor.
Okay.
Oh, and body language. Don't want to forget that. If you're sitting like this, even if this is a comfortable way for you to sit, which it is for some people, they watch TV this way, but that's not really being open. You're not giving the right signals. You want to be careful, too, about the tone of your voice. You don't want to be yelling at your doctor. So you want to watch all of that.
Okay. All right, great. And what can a person do if your communication with your doctor don't work well?
Yeah, so this happens. It's really important you speak up. I think people are intimidated by doctors, so they have a tendency to leave the appointment a little confused or having other questions. So you need to speak up. There are ways to do it though. It's okay to say, I have more questions or I don't understand what you said to me. Could you explain it again? Remember requests versus demands. Make sure you're asking a question at the end. So you can even say, doctor, I'm really worried about X and I don't feel you're hearing me. Can we discuss this further? You can also say, I realize you were out of time with me, but I'm wondering, could I schedule another appointment with you and we could discuss this further? They might even say, you know what, I'll call you after hours. So you may not even have to do another appointment. But I often say, just remember, can we discuss this? That's a question. So you can say, I don't understand, or I don't think you're hearing me. Can we discuss this? Is a great way to let your doctor know. And there are times when maybe a patient and a doctor are not the best, I would say, compatible communication-wise. And I do encourage people, if you really feel your doctor is not hearing you and not responding to you the way you feel you need to be, look for another doctor. You know, it's not saying anything bad about your doctor. You just have different communication styles.
It's good advice. And can you give us more tips on how to make the most of your appointment?
So preparation is really important, and part of that preparation is you want to tell a story. So instead of saying, "Doctor, I have this back pain occasionally," well, that doesn't really share. So you want to think like how, when, where. So for your story, so doctor, I have this back pain located here. It's a sharp pain, could be tingling, numbness, dull ache, but it's a sharp pain. It happens when I get out of bed in the morning. That's the worst time. And on a scale of 1 to 10, 1 being, I'll walk it off, and 10 being, oh my gosh, we got to go to the hospital right now. Give them a number. Your doctor will then have the ability to know, so you have this lower right lumbar issue when you get out of bed and it's a 6 on the pain scale. Otherwise, if you just say, "Doctor, I'm having back pain," then they spend 20 minutes just doing 20 questions, right? And that cuts into that 16 minutes of time you have. So the better prepared, ready to tell your story is important. Also, if you can take someone with you, it makes a huge difference. It could be a spouse, a partner, your best friend, adult child. If you have maybe a medically complicated situation, or you really don't have someone like that in your life that can go with you, that's when you hire a professional healthcare advocate. We attend doctor's appointments with you, so the 3 of us are discussing your health.
Good.
Oh, and one other thing, medical records. Access your medical records. So many people do not realize you need to have your medical records. So every doctor you have is connected to some sort of platform, which we call patient portals, right? You just call your doctor up if you're not on that, and they will give you what the website is. You create your own account. Your tests will be in there. Your x-ray results will be in there. Notes from your last exam will be in there. You can ask for refills on the portals. You can also send what is like an email, but it's actually just between the portals, so it's almost like messaging. Now, if you're not tech savvy and some people aren't comfortable, call your doctor's office and get your medical records, and they'll either send them to you by mail, or if you are on email, they may send you a PDF. If none of that is available to you or not comfortable with it, hire a healthcare advocate, because we will access it. And you may have multiple doctors that you need to get from, and I've had many clients say, I can't take that over, I'm just getting frustrated. So I gather all the data together.
Okay, that's great. And can you give us some guidelines for using the internet?
Yeah, so the internet's amazing. There's so much amazing information out there. Unfortunately, a lot of it is amazing disinformation. So you have to be really careful, particularly with healthcare. If you Google a particular drug, up at the top on the first page will be the drug manufacturer's ads for you, basically. And many people don't realize that. They go, "Oh, that's the name of my drug." They click on it. But it's an ad. They're trying to sell you on their drug. Now, if you don't mind and you look aside from the ad and you just want to know what are some of the side effects of the drug, maybe, you can do that there. But I really recommend that you use third-party sites. So, for example, the Mayo Clinic has a website, mayoclinic.org, that is independent. You can put drug names in there, you can search diseases in there, you can search treatments there. Also, medlineplus.gov is another third-party site, so you want to be careful about that. And another point that I try and tell people is be cautious about Yelp reviews of your doctor. So 1,000 of us go to Dr. Smith, and we love Dr. Smith, but one person goes to Dr. Smith, goes on Yelp, maybe they had to wait 45 minutes over their appointment time to see him, and they're grumpy, and he gets a 1 star. Well, I didn't think, I've never gone to my doctor, have you, on Yelp and said, "Oh, I really love my doctor," which I do, she's great. So you have to be cautious about that. The Yelp reviews are really usually showing you disgruntled people, and you don't have any perspective to that. So you want to do more just the name search of the physician. You want to look at their education. You want to know where they did maybe the residency, internship, the hospitals they're affiliated with, because if it's not the hospital near you, you might want to look at a different doctor, and their years experience. And I have one caveat to that. The best primary care doctor I ever had only been practicing 3 years. So I tell people, be cautious, think about it, put all the information you gather together. So mainly it's just a warning, be cautious of the internet, be a good consumer of information.
Okay, right. And can you please explain a patient who is a good communicator?
So we go back to that preparation. That's really important, right? You want to be able to tell that story. You want to be able to communicate with the doctor, so you want to listen and you want to do everything you're doing. You will speak up if you have questions or concerns. It's okay to ask questions. Again, that goes back to the prep that may be beforehand, but you may be talking to your doctor and they're recommending an exam and you don't know what to do with that. So you want to know more about that exam. So that will help you. You're also really aware of the doctor's time, so you want to be mindful of that. It's important.
Okay. And please give us some websites for searching healthcare advocates.
Yeah, I just want to make sure I get them because they're a little
Of course.
complicated. There are two major organizations, and then there's a chapter of Massachusetts, location of professional healthcare advocates. So the first one is the National Association of Healthcare Advocacy. So that's www.nahcacna.org. I know it's a little complicated, but you get there. The other is the Alliance of Professional Healthcare Advocates, and that's aphadvocates.org. Okay. The Massachusetts is www.mahealthcareadvocates.org.
Okay.
Okay.
Great info. And Lynn,
And they all have searchable directories, so you can put in your issue or your location. So there are ways to search for someone.
Excellent, excellent. And is there anything else that you would like to add for our audience to learn about advocacy?
I think that people just need to know that our healthcare system is so complicated that you need to think of your healthcare advocate as a GPS system for you to navigate through it. And almost everyone will talk to you for at least 20 minutes for free to understand what your issue is and what they may or may not be able to help you with.
Okay, that's great info. And Lynn, can you please give us your contact info if anyone has any questions for anything that we talked about?
Sure. So you can go to the website, which is www.advocating4yourhealth.com. You can email me at lynn@advocating4yourhealth.com. And you can call me at 857-210-8602.
Okay, great. Thank you. I'm sorry, but that's all the time that we have. Thank you, Lynn, for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.
Dad! They took over my bedroom! Come on, come on! Okay, Dad. 1, 2, 3. Dad! You saved me! Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.